My name is Denise, and in this video we're going to talk about how to survive your first year as a Pacu nurse. This is your first time seeing my face on this channel. Welcome. Please don't forget to hit that subscribe button. I make videos related to nursing, vlogs, lifestyle. Sometimes I do hauls. So today we're going to talk about how to survive your first year in Pacu. I do have my tablet here just to go over stuff so I'm not all over the place. If you're a nurse or a nursing student planning to go into Pacu, here is how you can survive your first year, because Pacu was not easy for me to transition into, coming from a step down cardiac floor. So here's what I've kind of learned and what I've collected throughout the years of being a Pacu / pre-op nurse. The first one is finding a mentor or a preceptor that you can trust. Like, you don't get a choice on who your preceptor is going to be. They kind of just be like, oh, you're going to be training with this person for X amount of weeks. Pacu is very stressful. It can be very stressful, especially transitioning from a different unit. There's so much to learn, unless you've worked like in the ICU or something like that. But it was definitely like a culture shock for me initially, learning from like experienced nurses and shadowing even right before you start Pacu. If you're thinking about it, I always mention go shadow first before you actually jump into applying and starting the job, because if you don't know anything about Pacu and you're just going for the vibes, like everybody talks about soft life nursing, and you're just going there because of that, you might be in for a shock. Like, it's a great place to work, but you just shadow first, see how you like it by watching other nurses go through a few hours of their day, ask all the questions, and then make your decision. But if you're already in it and you're just trying to figure out, how do I survive, how do I I'm feeling a little overwhelmed, I'd say your preceptor is your best friend, or should be your best friend. I hope you have a great preceptor. You can always ask them questions. Number 2 is always think about your airway. In Pacu, airway is so important, amongst other things, but airway is so important because patients are coming from having anesthesia and being sedated and being intubated, all of these things, especially with the medications that they're getting also for pain. It can make them more sleepy after having anesthesia, and so their breathing kind of gets a little bit slower. So tip number 3, so learn your anesthesia medications, because they will be on rotation. They will be the same type of medications on rotation, especially like anesthesia medications and how they react with certain medications for your patients. So like the sedative medications like Versed, fentanyl, Zofran, like promethazine, all of these medications that help treat pain, nausea, also like the reversal agents. Just know those medications because they tend to be the same. So over time, you're gonna start seeing the same medications. Just learn them and learn the side effects and how they interact with your patient. Tip number 4 is learning to stay calm under emergencies or during emergencies. Obviously, as nurses, we go through emergencies sometimes way often than we'd like, but depending on what floor you came from, you're gonna probably be already used to having emergencies and code blues and rapid responses, and like knowing how to stay calm under those. But also, like, if you came from a floor where you weren't really used to it, learn to be calm and learn to just like manage stress without panicking, for lack of a better word. Tip number 5 is time management and prioritization. Coming from inpatient nursing, you have to juggle like 4 patients at a time, and then have doctors coming to you, pharmacists calling you, dealing with like patient care techs and CNAs and different nurses, family, other patients. So if you're coming from inpatient to Pacu, that time management skill should already kind of be like formed a little bit, depending on how long you've been a nurse, because Pacu just makes it a little bit more enhanced. But you do have 2 patients you have to deal with. What I find is a struggle is when those 2 patients you have at the same time, they are both dealing with pain or nausea, so you're going back and forth treating pain here, nausea here, and then also like the medications you give in Pacu, they're so like their duration are so short-lived that you have to give them constantly. And you could be giving fentanyl every 8 to 10 minutes, especially if a patient is just like very tolerant to pain and you're just trying to manage it to where you get them to a comfortable level. You really have to be on your pain medication, be like the drug lord. Like you have to be on it to make sure their pain doesn't go all the way up to where now you're playing catch up. So, and then that leads me into topic number 6, which is managing pain and nausea. Sometimes really you don't need pain medicine, you just need to help them reposition. Sometimes even, like I remember when I was in my first, like I don't even know, my first few weeks in Pacu when I was in orientation, I had a patient with my preceptor, and this patient was just in pain. She was just like completely like complaining of pain. We'll give her pain medicine and it just was not helping. She started getting nauseous. We gave her nausea medicine. It wasn't helping until my preceptor just was like, okay, let's try to sit up. She sat the patient up, and literally it was a grown woman, sat her up and started patting her on her back. Like, you know when you're carrying a baby and you're trying to burp them? That's literally what she did. And that lady burped and her pain all of a sudden went away. Like she was so much more comfortable and was so grateful, because I think she had an abdominal gastro procedure. I can't remember exactly the details of that, but it was something to do with like the gas, and it just was making her really uncomfortable. So no medication we were giving was helping her until she repositioned and she felt better, repositioned and burped and felt better. So always think of that too. Like positioning can be a great factor in help managing somebody's pain. Next thing is communication. Communication is everything in Pacu because you're dealing with so many different people. The surgical team, which they have like their residents, their fellows, all of these other people. The anesthesia team, same thing, CRNAs, the student CRNAs, other nurses, charge nurse, family. So communication is very important. Getting your handoff from anesthesia, make sure you're asking them all the questions that you need to ask them when your patient first rolls. What my preceptor taught me and what I do to this day, make sure you listen to your patient, like their heart and their lungs, and if they had any abdominal surgery, listen to their stomach as well. That's very important when they first roll into the Pacu bed space with the anesthesia still around, because then if you catch something, you hear something, it's not just that they handed you the patient was good when they handed it to you and then something did happen, then now you have to go and call them back, and then it's prolonging the care of the patient. Turn my phone off, it's getting very distracting. Looking at their surgical sites, wherever it may be, and do that with the surgeon in the room. Make sure everybody's on the same page what it's supposed to look like, the color of their incision. If there's a drain coming out of them, make sure that the drain, whatever is in that drain, is supposed to be that color. If not, then ask the surgeon, what color do you guys expect coming out of this? Because more than likely the patient is also going to ask you this question when they're more aware, or the family member is going to ask you. So, you know, if they have a Foley catheter that was placed, make sure, like, is their pee supposed to be coming out red, or is it supposed to be light pink or pink tinged at this point? Like, what is the expectation? You're supposed to get the first initial vitals before the anesthesia team can walk off. So if you got their blood pressure and their blood pressure is like 170 over 90, make sure you ask them, like, is this normal for them? Was this how it was pre-op? If it's not, like, what was their normal baseline before they had surgery? And also, like, if it's normal for them, like, you know, is there something we can give them to help bring the blood pressure down before they go home? More than likely, some patients, they come out and their blood pressure will be through the roof. Some of them it's lower, but some it might be high, and it could just be because they haven't taken their blood pressure meds before surgery or the night before, or the surgery was very stressful on their body and it's just their body is responding to that. So obviously, if you have questions after your handoff and the team already left, you can always page them. Make sure you always ask for the pager number for the direct person that you should be paging for whatever the reason is. If you ask all these questions, you know how much blood they lost, all this stuff. If the patient is not going home and they're going to be admitted, guess what? You have to give that report to the nurse that you'll be calling, and you have to tell them all these things because they will ask you all these questions as well. And you don't want to give them like a halfway report, or like most of your answers is like, oh, I don't know, oh, I don't know, I don't know. So it's always important to start off just getting the most out of the anesthesia team and the surgical team as well before you send your patient home or send them to the floor. And if they're going home, guess what? You're going to be educating them. You're going to be giving them all the stuff that they need to know, everything that you know from the surgeon, from the anesthesiologist. You will be transferring that to the patient, or more than likely it's going to be the patient's family member. I hate sending my patients home with an unanswered question. I will try my hardest. I've called pharmacies, like, or even Google different pharmacies that are open 24 hours, so that I can call the surgeon or the anesthesiologist again and be like, hey, can you send this medicine to this place because this pharmacy is going to close by the time they go home. Just something that can be so simple can make a huge impact. So definitely just communicate. Don't be afraid. Ask questions without fear. Be so open, like your life and your license depends on it. Like, it's literally better to ask and learn than to assume and make a mistake, because these are human beings we're dealing with every single day. And like, you know, it's like, it's so serious. So how everyone says there's no stupid questions, they could be stupid questions, but I don't care if it's a stupid question. I'm gonna ask you anyways, because I rather you look at me like, why would you ask that, and still give me an answer, than for me to assume and just do something because I think that's what the answer is, or that's what I'm supposed to do. You know what I mean? Like, I just never understand. I never understand someone who would like just do something because they feel like that's what they think they're supposed to be doing. I'm like, girl, like, be for real. And then number 9 is take care of yourself during your shifts. Please take care of yourself, because the amount of nurses that don't take breaks, like, this is not even a conversation we need to have anymore, because at this point we're taking our breaks. Because why are we not taking breaks? Pacu can just be so stressful sometimes. You might not even have downtime. You might go through your whole 12-hour shift and not have a time where you didn't have a patient. So make sure you're prioritizing yourself as well as your patients. It's your lunch break. Go on your lunch break and leave work at work. Like, step away from the working floor environment and go on your break, like in the break room or outside, or somewhere where you can see outside if you're inside. I always try to take my breaks either like sitting, because our hospital, we have like big windows and stuff where there's like a lot of sitting areas, and you can just go, and it's in corners. I love corners. I don't know what it is, but I love corners. Like, it's in a corner, you just go, there's so many windows, you can see a whole bunch of trees, you can see traffic going on outside, and like, if it's a sunny day, you can get the sun shining on your skin. Where I work in Pacu, like, sometimes if you sit in there for too long, you won't ever know what day it is, like what time of day it is. I mean, like, is it sunny? Is it raining? Is it cloudy? Is there a storm happening outside? I have no idea, because I've been here all day, you know? Drink your water. We don't need to go into detail about that because we're already drinking our waters, right? If you have to go pee, ask somebody to cover for you real quick for a few minutes so you can go pee. Like, drink your water. Overall, the last thing I feel like I'm gonna add is give yourself grace. You're a human being, you know? Mistakes do happen, but if you're asking the questions, you can prevent your mistakes from happening. You won't know everything right away in Pacu. There's still so much to learn. And then even after you learn, there's always a new thing being added, and like new policies being added, new medications being added, new freaking pump machines being added. And so you're always gonna be learning regardless. So give yourself grace and make room so you can learn these things. And we're not perfect. We're just nurses that are trying our best to take care of our patients and make sure they can safely go home to their families, you know? Just have grace with yourself and love on yourself and take care of yourself. If you're a new nurse in the PACU or thinking about going into PACU, comment down below 3 things or less that you took away from this video, or just things that you wish you knew before you went into PACU that I haven't covered in this video. As always, don't forget to hit the subscribe button below. Thank you guys so much for watching, and I will talk to you guys on my next video. Bye guys.